Hello everyone, welcome back to Shivani's Maternity Mentor. I'm Shivani, and today we'll learn one of the most important topics in obstetrics, the fetal skull. What is the fetal skull? The fetal skull is the bony framework of the baby's head. It is specially designed to allow the baby's head to pass safely through the birth canal during labor. Unlike an adult skull, the bones of the fetal skull are not completely fused. They are connected by sutures and fontanelles, which allow the skull to mold during childbirth. Now let's understand the parts of the fetal skull. The fetal skull has three main parts: vault, base, face. The vault is the upper part of the skull. It is soft and compressible, so it can mold during labor. The base is the lower part of the skull. It is rigid and does not mold. The face consists of the facial bones. Next, let's learn about the bones of the fetal skull. The fetal skull consists of two frontal bones, two parietal bones, two temporal bones, one occipital bone, one sphenoid bone, one ethmoid bone. Among these, the parietal and occipital bones are especially important in obstetrics because they help identify the position of the fetal head during labor. Now let's discuss the sutures. Sutures are fibrous joints between the skull bones. There are four important sutures: frontal or metopic suture, sagittal suture, coronal sutures, lambdoid sutures. These sutures allow the skull bones to overlap during labor, a process called molding. Now let's understand the fontanelles. Fontanelles are soft membrane-covered spaces where the sutures meet. There are two important fontanelles. The anterior fontanelle, also called bregma, is diamond-shaped. The posterior fontanelle, also called lambda, is triangular. During vaginal examination, healthcare providers feel these fontanelles to identify the position and presentation of the fetal head. Now let's see why the fetal skull is important in obstetrics. The fetal skull allows molding during labor, helps determine fetal position and presentation, assists in monitoring the progress of labor, helps assess whether the baby's head can pass through the maternal pelvis safely. Quick revision: 3 parts: vault, base and face. 7 bones: frontal, parietal, temporal, occipital, sphenoid and ethmoid. 4 sutures: frontal, sagittal, coronal, unlambdoid. 2 fontanelles: anterior bregma and posterior lambda. Now let's discuss each diameter one by one. 1. Suboccipitobregmatic diameter. The suboccipitobregmatic diameter measures 9.5 centimeters. It extends from the suboccipital region, just below the occipital protuberance, to the center of the anterior fontanelle, also called the bregma. This diameter is seen in a well-flexed vertex presentation. It is the smallest antero-posterior diameter and is the most favorable for a normal vaginal delivery. 2. Suboccipitofrontal diameter. The suboccipitofrontal diameter measures 10 centimeters. It extends from the suboccipital region to the center of the frontal suture. This diameter is present when the fetal head is in incomplete flexion. It is usually seen when the head is slightly deflexed. 3. Occipitofrontal diameter. The occipitofrontal diameter measures 11.5 centimeters. It extends from the external occipital protuberance to the glabella, which is the root of the nose. This diameter is associated with a deflexed vertex presentation. Since it is larger, labor may become more difficult. 4. Mentovertical diameter. The mentovertical diameter is the largest antero-posterior diameter and measures 13.5 centimeters. It extends from the chin, also called the mentum, to the highest point of the vertex. This diameter is seen in brow presentation. Because it is the largest diameter, normal vaginal delivery is usually not possible. 5. Submentobregmatic diameter. The submentobregmatic diameter measures 9.5 centimeters. It extends from the junction of the neck and chin, called the submentum, to the center of the anterior fontanelle, or bregma. This diameter is seen in face presentation with complete extension. It is the most favorable diameter in face presentation. 6. Biparietal diameter. This diameter, also known as the transverse diameter, measures 9.5 centimeters. It extends from one parietal eminence to the opposite parietal eminence. This is the largest transverse diameter of the fetal skull and is the diameter that normally engages during labor. 7. Bitemporal diameter. Bitemporal diameter is the maximum distance between the two temporal bones of the skull, measured from one temple region to the other. If you found this video useful, please like, share, and subscribe to Shivani's Maternity Mentor. Don't forget to press the bell icon so you never miss our nursing lectures. Thank you for watching. See you in the next video.